This is the third in a series of presentations on radiography of the skull in the veterinary patient. The intent of this presentation is to describe and provide examples of the radiographic diagnosis of sinusitis in the horse. By the end of the presentation, I want you to be able to identify affected sinuses on radiographs, as well as evaluate for and identify potential underlying causes of sinusitis, specifically including tooth root abscesses. Sinusitis is characterized by the accumulation of fluid in one or more of the nasal sinuses and is a common indication for horses for radiography of the skull. Sinusitis is commonly due to empyema from tooth root abscess or dental disease. However, there are several additional possible causes which are listed on the slide. Causes are not in any specific order, although trauma is probably more likely than some of the other listed causes, as trauma can cause displacement of bone into air-filled spaces and can lead to both acute and chronic sinusitis. Neoplasia is fairly rare in the horse, and if it is there, probably squamous cell carcinoma is the most common, but adenocarcinoma, fibrosarcoma, and lymphoma can also occur. This slide talks about radiographic findings that we might identify in sinusitis. And the most important thing I want you to look for is fluid or fluid lines in the sinuses in horses. If we display the image in the same manner as how the horse's head was positioned, we are obtaining these radiographs almost always with a horizontal beam, and so then we can look for fluid that is filling partially the air-filled sinuses, and we'll see it as a line that is parallel to the floor. We might also look for soft tissue opacity or masses in the sinuses, and then whether or not there are osseous changes, seeing lysis, or even potentially proliferation will depend on the underlying cause. On the right of the slide is an example of a lateral view of a horse, and again, this lateral view I've actually displayed as the horse's head was positioned when we obtained the radiograph. In this maxillary sinus here, so we have the rostral and the caudal compartment, we can see that there is increased soft tissue or fluid opacity, and we can see this discrete line between air, so like a gas cap on top of fluid, and notice that that line is, in this case, parallel to the floor because that was how the horse's head was when we obtained the radiograph. So this is what I want you to look for to see fluid lines in the sinuses. So here's another example. The patient is on the left without labeling and on the right with labeling. So again, this is a lateral view that is of the sinuses and the nasal passages in this horse. I have displayed the image as the patient's head was when we took it, and we may or may not know that, but in this case it is. When I look at the area of the maxillary sinuses, in the rostral compartment here, I can actually see that there is a fluid line here, so soft tissue or fluid opacity noticed in the ventral part with a discrete line between air, but there is also a second fluid line. Again, these lines are paralleling the floor, and there is kind of air on top of it. And so what that actually tells me is that this horse has fluid in both the left and the right maxillary sinuses, and specifically it's in the rostral compartment. I want to spend a little bit of time in the horse on tooth root abscesses. Again, in the small animal patients, I'm going to have the dentist talk about dental disease because you'll learn a lot more from them. But because we radiograph entire horse heads oftentimes and look for underlying causes of sinusitis, and tooth root abscess is a very common cause, I do want you to be able to identify this on a radiograph. So what we are going to look for, besides probably identifying increased fluid, soft tissue opacity in the sinus, sometimes actual fluid lines, are teeth that are affected. And remember that the caudal maxillary premolars and the rostral maxillary molars actually have their roots that are in and closely associated with the sinuses, and so that is why when they get infected, the sinuses are oftentimes involved. This is an oblique view of the lateral maxillary arcade, and the things that we're going to look for are changes in the periodontal space. So by this tooth root here, there is widening of this periodontal space. as well as maybe even a bigger pocket of perioapical lucency in the alveolar bone. So we have periodontal space widening and then some lucency, but then there is also increased soft tissue opacity around the roots here of this tooth. Sometimes it'll actually be almost mineral opacity, so we can actually get sclerosis of the bone itself. And then oftentimes the tooth that is affected will have blunting or distortion of the roots. So if we look at the tooth rostral to it, this is a pretty normal tooth with normal roots, and caudal to it, at least this root is normal. I think this tooth is probably also affected by this infection of this third premolar. And then sometimes the teeth will actually be fractured or broken. So this is a patient that has presented for sinusitis, and when we look at radiographs, especially of the left maxillary arcade here, because the L is telling me left side, we can see signs that that third premolar or tooth 208 is infected. Here's another example of a patient that is presenting for sinusitis. And in this patient, this is a slightly oblique lateral view. The R up here is depicting that they were trying to demonstrate the right maxillary arcade and the right nasal passages. But notice there is not a lot of obliquity because the teeth are still fairly superimposed. But in this patient, around this first maxillary molar, there's quite a bit of soft tissue and probably bone opacity, so sclerosis, a lot of change in opacity. This is in the area of the maxillary sinus. And then if we look at that maxillary molar, notice that there is lucency in the periapical region. And then these tooth roots here are quite blunted and distorted and much shorter than the teeth roots rostral to it and caudal to it. And then if you look closely, I can tell that this patient's head was not in this position when we took this radiograph, because here is actually a fluid line that also shows that there is fluid within that maxillary sinus, the rostral compartment. So that is our fluid in the sinus, and it's secondary to this tooth root abscess. Here's just an example of a patient that actually has a tooth root abscess of the mandibular teeth, because you're going to identify that a lot as well. In this patient on the left side is a left over right oblique, so we're looking at the right mandible, and on the right side is a right over left oblique, so we're looking at the left mandible. And this patient was presenting probably for a swelling on his jaw. And if we look at the affected side, there is this kind of distortion of the ventral cortex of the mandible, and the distortion is because there's actually a periosteo reaction that's a little bit irregular. There is also some lysis in part of the cortex, as well as periapical lucency around this fourth premolar. Some soft tissue swelling, and even a little bit of lucency through that periosteo reaction. So there's probably a tract there where the drainage may come if this patient actually had a draining tract. And then the tooth roots are also somewhat blunted and distorted compared to the unaffected teeth. And we can compare to what that normal tooth should look like on the left side. So again, this would be findings that would be very consistent with a tooth root abscess. Here are lateral and dorsal ventral views of a horse that has sinusitis. On the lateral views, I can see in the area of the maxillary sinus that there is a fluid line here with fluid opacity kind of in the dependent part, fluid line with gas in the caudal compartment of this maxillary sinus. I believe there is too much fluid opacity in the rostral compartment as well. And as we keep looking around our nasal passages, there is actually another fluid line here that is within that frontal sinus. And then the frontal sinus kind of overall look increased in soft tissue or fluid opacity. So besides having fluid, there may be more diffuse disease. This patient also has some increased kind of non-uniform soft tissue opacity in the rostral nasal passages, so that we're not really in any sinuses now, so there's probably some other nasal passage disease. On the dorsal ventral view, remember, we can hopefully, if it's unilateral, look for one side to compare to the other side. This patient is pretty normal on the right side, so you can see the maxillary sinus and the right nasal passages. But if you look, the left nasal passages have increased soft tissue opacity, and portions of the left maxillary sinus have increased fluid and soft tissue opacity. I don't believe that this patient had a diagnosis of the cause of the sinusitis, so this might have been a primary sinusitis. Here's a patient, a lateral view, and then an extremely oblique view of one of the maxillary sinuses. It's unlabeled, so we don't know. This patient is presenting for sinusitis. If we look on the lateral view, quite a bit of soft tissue fluid opacity, probably only in one of the sinuses, because I can still see some structures through that probably are the unaffected sinus. A nice fluid line here with the gas in the rest of that caudal compartment of the maxillary sinus. So this is the rostral and part of the caudal compartment of a maxillary sinus. Notice this patient also has fluid line in this frontal sinus. Because of all of these sinuses communicating, oftentimes one diseased sinus can obstruct drainage from another diseased sinus. On this extreme oblique view, I can see this lobulated soft tissue mass that is in the sinus and kind of nasal passages. And so when I see this mass, differentials would include neoplasia, so if this was quite an old horse, potentially a paranasal cyst, because cysts, although they are fluid-filled, will obviously look like soft tissue masses because of the opacity being the same. And although I don't have it listed on the slide, this could be some odd granuloma as well. And then I wanted to finish up with a very brief discussion on ethmoid hematoma, which happens in horses, and I have the radiographic findings here. These are usually occurring in horses that are older than 7 years, and it seems that Arabians and thoroughbreds might be overrepresented. Oftentimes these patients present for epistaxis, so bleeding from the nose, but they can present with mucopurulent discharge as well. Most often this is a unilateral process, but sometimes it can extend across bilaterally. On the dorsal ventral view in this patient, one of the radiographic findings that we can look for is a round or oval, smoothly marginated soft tissue mass that is typically in the kind of caudal nasal passage or ethmoid region. So on this dorsal ventral view, the ethmoid turbinates are kind of these osseous lines that are back here. And on the right-hand side, I can see this oval soft tissue mass. It's kind of distorting some of the structures of the caudal right nasal passage. Compare that to the left normal side. On the lateral view, usually the ethmoid hematomas will be more dorsal, kind of in the area of where the ethmoid turbinates are, which are kind of superimposed over the bony orbit. But in this patient, it's a little bit more ventral in the caudal nasal passage, and it is this soft tissue mass here. And then oftentimes you might see associated fluid opacity in the nasal passages. I have listed chapters and reference pages in 2 different textbooks, the Thrall that has both small and large animal and the clinical radiology of the horse. Really want to encourage you to consult those textbooks to find additional information in the actual written text, but especially to just look for some additional examples of sinusitis and the various causes of sinusitis, and especially tooth root abscess.